presenting Abilify. This medication is mainly used for people with schizophrenia. All right, so Abilify, it's also known as, sorry if I mispronounce it, aripiprazole. Yeah, I knew I would butcher that. It's a more recent developed medication that's mainly used for schizophrenia, manic episodes associated with bipolar 1, major depression, autism, and Tourette's syndrome in adults and adolescents. Pharmacists have developed both an oral medication and a long-acting injectable, also known as an LAI. It can be used in combination with other medications to treat depression and is an antipsychotic drug, which is an atypical type. It works to help individuals think more clearly and positively, feel less nervous, and be more active in their everyday life. For many individuals, it has been shown to decrease mood swings, treat severe mood swings as well. The mechanism of functioning is to help restore the balance of certain chemicals in the brain that are neurotransmitters. This can in turn help decrease hallucinations and improve concentration. It was one of the first antipsychotic drugs developed to fight dopamine autoreceptors. This is a crucial target of all antipsychotic medications. The medication is characterized by its combative abilities of dopamine and serotonin receptors. So it works to fight and balance out the dopamine and serotonin in somebody's brain. All right, so neurobiology. Abilify acts as both a partial antagonist by blocking specific transmission of certain signals, and then a partial agonist, increasing the frequency of other signals. This medication is a dopamine stabilizer, and that means it acts as a dopamine receptor antagonist when the dopamine system is overactive, and then acts as a partial agonist when dopamine levels are low. So it kind of just balances out the dopamine that an individual with schizophrenia, depending on how their levels are, it can balance it out to an even level, or it can raise it to the right level. It works both ways. It is capable of this because it is very similar to a dopamine receptor, creating a bond to the receptor in place of the dopamine that's missing, or it can combat the dopamine that is too high, finding that balance again. It does still activate the receptor, but it does this on a much weaker level than dopamine itself does, and that's kind of what creates that balance. So this then reduces the overactivation of the dopamine system, creating the imbalance of chemicals to be leveled out, and the hallucinations, irritability, and all the other symptoms of anxiety and stress to be lessened. Abilify also acts on other neurotransmitter receptors like serotonin, specifically 5-HT. It bonds to the 5-HT serotonin and produces a similar response to the intended serotonin chemical. However, it works in a different way when the serotonin 5-HT2A. That's just a different serotonin receptor than the serotonin 5-HT. So it works with serotonin 5-HT2A by binding to the receptor either on the primary site or on another site and stopping the receptor from producing a response. So again, it kind of blocks it for somebody that might be producing too much dopamine or serotonin, and then it is bringing it down to that same level of normalcy. This medication uses dopamine to balance out the chemicals in the brain to a normal level by fighting and aiding neurotransmitters to balance out. This then helps the individual fight biological and psychological effects. Biological effects. There's a long list of biological effects that Abilify can cause over a period of time. These effects can range from simple to severe. Simple biological effects include a headache, heartburn, constipation, diarrhea, increased salivation, tiredness, and pain in the joints, specifically in your arms, so your shoulders and your elbows. Typically, this is seen with a lot of other medications as well, so it's kind of a little bit more of the common stuff that you would see when taking medications. These effects are not as severe as the other biological symptoms, according to research, due to taking approximately 6 months for medications to take a full-on effect. This means that the small biological effects have been shown to only occur during the first 6 months of using the medication, so they don't last very, very long. The more severe biological effects would be stomach pain, changes in appetite, weight gain, rash, swelling of the eyes, difficulty breathing, changes in vision, uncontrollable shaking, specifically of your face and your mouth, kind of like an allergic reaction, stiff muscles, issues with coordination, things like that. Seizures is another really big one that people see with this specific medication. It is incredibly important for individuals to report those effects because they can continue to worsen or cause larger problems for a longer period of time. But there's not enough research on the period of time that it takes to develop those effects. Psychological effects. This medication can decrease hallucinations and improve concentration while thinking more clearly and positively, but it does have some pretty serious psychological effects. So this list is definitely not as long as the biological effects, but it might be more serious than those biological effects, because the biological effects are what we typically see with medications. So such psychological effects would be mental and mood changes, because it is creating a new imbalance in someone's brain. So that does kind of mess with how someone is feeling and thinking. It messes with that whole process. So those changes do exist, and some people it provides them with better positivity, and then other people it doesn't necessarily do what we want it to do. It can also include anxiety, depression, and suicidal thoughts. This is less likely to happen when the individual is taking the correct dosage and is taking it as prescribed. If an individual is experiencing those mental changes and mood irregulations that they typically do not see happening, and it's not listed as something that could be a positive for the reason why they're taking this medication, then they, of course, should report that to their doctor and try to change the dosage levels. That can be one way that can be addressed. One specific study that was completed found that drugs like Abilify were associated with serious impulse control disorders. So these specific researchers identified about 710 events. That's a lot, that's a really big number. So 710 events that could indicate impulse control disorders with dopamine receptor agonist drugs, which Abilify would classify as one. So these events included things like gambling, compulsive shopping, hypersexuality, and even the tendency to wander away. So as I said, it can be a very serious psychological effect that one might experience, but there is definitely not enough research on how long it could take for that to develop. All right, impact on society and individuals. So schizophrenia is a chronic disorder associated with significant disability and social functioning. Abilify has supporting evidence that shows the improvement it can create in the social functioning of individuals. One study completed 2 post hoc tests and reported the effectiveness of Abilify in maintaining and improving social functioning. So this included skills like getting a job, maintaining a job, making friends, communicating at the store, and advocating for yourself at the doctor's office, because this is something that people with schizophrenia tend to struggle with. They get stereotyped, and people see schizophrenia as listed as a disorder or a disability, and it freaks them out because all they see is the bad, right? So this study was able to prove that Abilify, this medication, can aid the individual in their social abilities, which can minimize the stereotype that people are experiencing in society. So this medication has been able to break down this barrier, and individuals with schizophrenia have become kind of like a normal piece in society. These improvements in social functioning have allowed many individuals to do daily activities that provide a sense of normalcy, which is very different from anything that they have experienced in the past. So this medication could definitely give them that normal feeling. Conclusion. All right, so Abilify, also known as the aripiprazole, it's a relatively new medicine, and it treats a variety of mental and mood disorders, specifically schizophrenia, as we talked about. Now, this drug, pharmacists have produced both an oral and the long-acting injectable, which you can see here on this slide. You do have to go to a doctor to get it injected, whereas the medication orals you can just take home and get your prescriptions refilled. But sometimes for people with schizophrenia, that doesn't work. They forget to get their medications, they forget to take them, so that injectable helps when they have to go to an appointment and get the dosage. So when the dopamine system is hyperactive, Abilify helps function as a dopamine stabilizer. And it kind of acts as a dopamine receptor antagonist, and then a serotonin agonist, creating balances within the brain chemicals, and then creating a sense of normalcy for that individual. There's a long list of biological effects of Abilify that create serious issues if left alone and untreated. However, more research is needed to identify long-term effects. The psychological effects are more specific, but are not as common as the biological effects. This could be due to other factors that the individual may be experiencing. It's might not just be the medication. This medication allows for individuals to work their way back into society with a lesser stereotype. Many people have been able to resume regular activities that give them a sense of normalcy as a result of these advancements of Abilify. All right, and here's my references. And thank you.